very warm welcome to the first of our BAPS Wellness live conversations. Not only is this our first live conversation with a panel of experts focusing on asthma and allergies in children, it's also our first session focusing on children's health. So I hope you enjoy our discussion. Our BAPS Wellness initiative is focusing on promoting lifelong lung health through the 4 pillars of nutrition, exercise, sleep, and stress management. And this holistic approach is inspired by the values of our gurus, Pujya Pramukh Swami Maharaj and Pujya Mahan Swami Maharaj, who remind us of the importance of maintaining physical and mental well-being to achieve optimal spiritual well-being. So let's start with some introductions.
My name is Sejal Saglani. I'm a pediatrician and I look after children with lung conditions, and my specific expertise is looking after children with asthma. I'm also a volunteer here at BAPS. I'm part of the healthcare team. And I'm joined today by Dr. Nandinee Patel.
Yes, and everyone. So I'm a children's allergy doctor. I work in London and specialise in treatments for food allergy. And I also volunteer at the Monday.
Great. And we're joined today by Mrs Sukeshi Makhecha.
Thank you for inviting me, Jai Swaminarayan. It's an honour to be here. I'm Sukeshi. I'm a consultant pharmacist in asthma, and I work in London with Sejal as well.
Great. So, Sukeshi, I think you wanted to start off by asking me a question about today.
That's right. So why are we here today? What are we talking about in terms of asthma?
Yeah, so why do we need to talk about asthma in children? That's a really important question. And one of the main things we need to remember is asthma is the most common long-term condition that affects children worldwide, not just in the UK, but everywhere. And specifically in the UK, about 1 in 10 children are affected by asthma, which means in every classroom, there'll be about 2 or 3 children that have asthma. But it's not just that it's common, and that's not the only reason we need to talk about it. More important reason that we need to talk about it is asthma in children can be quite serious and it can kill children. Every 4 weeks in the UK, a child dies of asthma. And that's simply because it remains undiagnosed or it's not treated properly. And so we really need to raise awareness about asthma in children so that we can treat it properly and prevent deaths.
So what exactly is asthma, and how do people or children die from asthma?
Yeah, so asthma is a condition that affects what we call the airways in the lungs. And what the airways are they kind of the tubes that we breathe in and out of. We've got breathing tubes in our lungs, which are kind of like an upside down tree. So the windpipe is kind of the trunk, which then branches on the left and right into smaller and smaller branches. And I've got an example here of what would look like a breathing tube. And as you can see, a normal healthy breathing tube has a thin wall and a nice open hole through which we can breathe in and out easily, and there's no problem, no difficulty breathing. But in asthma, it's quite different. What happens is, as you can see, the airway wall becomes swollen, and doctors often call that inflammation or inflamed. And that swelling or inflammation means that the hole that we can breathe in and out of becomes much smaller, and then that gives us marked difficulty in breathing. The other thing that happens is around the breathing tube are muscles, and in asthma they contract and they also make the breathing tubes very narrow. So overall, that narrowing of the breathing tubes results in difficulty in breathing in and out. So you might see a child struggling to breathe. Their shoulders might be going up and down. You might see their ribs pulling in and out. And the other thing that you might notice is noisy breathing. So asthma and breathing in and out of narrow tubes results in noisy breathing. And the term that we use to describe the noisy breathing is wheezing. Now, you might say to me, well, Sejal, what's wheezing? How would I know what wheezing is? And I completely understand that. It's a term that doctors use. It's a medical term. So to try and help everybody understand what wheezing is, we've got some examples of sound clips of what wheezing sounds like. So we'll play those now for everybody to listen. And then we've got an example of wheezing of a slightly older child, which we'll play now. Okay, so you understood what we mean by the noisy breathing and the difficulty in breathing that we see in asthma. But doctors won't just use how a child presents as a way of diagnosing asthma. There are specific tests that we now do to help confirm whether a child has got asthma or not. And those tests, some of them can be blood tests, but there are special breathing tests that doctors use to confirm asthma. They can sometimes be done by the GP, but for children, you need quite specialist input for those breathing tests, and a GP may refer you to a special centre to have those tests done to help confirm a diagnosis of asthma. And to understand what that breathing test might look like, we've got a video of a child doing that type of breathing test, which we'll show everybody now.
So what we're going to do now is you're going to put the nose peg on your nose, and you're going to start by putting the mouthpiece in your mouth. Make sure it's behind your teeth and that your tongue doesn't go in the hole, just so you can leave it underneath there. A nice tight seal, and we're going to start by doing some relaxed breaths. Just in and out a few times, okay, just to get relaxed and used to the mouthpiece. Once you're ready, you're going to take a deep breath in, fill up like a big balloon, and then you're going to force out as fast and hard as you can, okay, until you cannot blow out any more. So we're emptying those lungs completely, okay, and you'll hopefully see you'll get the bowling ball all the way to the pins. Once you're empty, you're going to take a big breath back in, and then that's that, and we'll just do that a few times to make sure we've got reproducible results. Does that sound good? Any questions? No? Let's give it a go, see how you get on. So again, make sure you're sat up nice and straight, feet flat on the floor, and when you're ready, pop the mouthpiece in for me. Just do some normal, calm, relaxed breaths in and out. And in, out, excellent. And one more normal breath for me. Okay, when you're ready, filling up as much as you can. Up, and fast. Push, 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 push. Keep it going until you're empty. Once you're empty, a deep breath back in for me. Excellent, and relax. Well done.
Okay, so that's given us an idea of how a child might present with asthma. But what you need to remember is one of the most important causes of asthma in children is actually allergies. And that's why we're talking about asthma and allergies together today. And that's why we've got our expert in childhood allergies, Dr. Nandinee Patel here today. So Nandinee Patel, what are allergies?
Thanks, Sejal. So allergies develop when your body's immune system, that's your defense system in your body, overreacts to try and protect you from things that you find in the environment that are not harmful, but your body's incorrectly identified them as harmful. And so we call things that you might become allergic to in the environment allergens. And your body can become allergic to things that you eat, for example, peanuts, or things that you put on your skin, for example, nail varnish, or things that you breathe in from the air around you, like grass pollen. And these allergies can also affect other conditions, like asthma or eczema or hay fever.
Okay, but then tell us a bit more about how allergies and asthma are connected. Where's the connection?
Yeah, so allergies play quite an important role in asthma in children in particular. And there are lots of allergens in the air that we breathe in and out every single day. And for most of us, our bodies don't notice those allergens. But for some children, they become allergic to those allergens in the air, which means that if they breathe those allergens in enough amounts, so in large enough amounts, it can trigger their asthma symptoms and make them wheezy. And some of the common air allergens include things like house dust mites. So that's something that you find in large amounts in your bed and other soft furnishings. And then things like tree pollen and grass pollen. So those are things that increase over the spring and summer. And then things like cat fur and dog fur. And then finally, another common one is mold spores. Now, those can be in quite high amounts in houses, especially houses where it's quite damp. And if your child is allergic to one of these air allergens and they're having an asthma attack, it can make the attack much worse. So it's really important that if your asthma is not well controlled, that you try and find out and check with your doctor if you have got these air allergies, because your doctor can then guide you as to how to reduce the impacts of those air allergies on your asthma.
You mentioned grass pollen, but I'm aware, obviously, grass pollen causes hay fever. So tell us about that.
Yeah, so you're absolutely right. So allergies to grass and house dust mite can affect your nose and your eyes, and that's called hay fever. But if it's affecting your chest, it's called asthma. Now, common hay fever symptoms include things like itchy eyes, itchy nose, sneezing, sniffing, watery eyes. And you might think, well, that's not that important. But actually, if you've got regular hay fever symptoms, it can affect your concentration in the classroom, it can affect your sleeping and therefore your growth. And so it's really important that if you've got more than just occasional hay fever symptoms, that you do speak to your doctor and get help with that. And then finally, the thing to say about hay fever is that if it's not well controlled, it can also trigger your asthma to play up. So that's another reason to really control your hay fever well.
Okay. And then the other type of allergen you mentioned are the allergens that we eat, food allergies. So tell us how they present, a little bit about that. Yeah, so food allergies are something that lots of people worry about. Actually, in reality, only about 3% of children in the UK have kind of food allergies. And when I talk about food allergies, I'm talking about immediate food allergies. Now, this is a really specific immune response, overactive immune response to foods. And if you've got an immediate food allergy, then if you eat the food that you're allergic to, you might end up having an allergic reaction. And that will include symptoms that include things like vomiting, abdominal pain, sneezing, itchy puffy rashes on the skin or skin swelling around the mouth or the lips or the eyes, and sometimes even coughing or wheezing. And these symptoms normally in this type of immediate allergy happen within a couple of minutes of eating the food you're allergic to, but can take up to 2 hours before you get the symptoms. And if those symptoms of that reaction include breathing difficulties or change in consciousness, well, then that's called anaphylaxis. And that's a serious allergic reaction and needs prompt treatment. Okay, so what foods can you have allergies to? I think we all know about peanuts, fair enough, but what's the kind of range of things that should be concerning?
So it's actually possible to become allergic to almost any food that you eat. The common ones in the UK are peanut allergy, as you said, milk allergy, sesame allergy, other nut allergies. But in the UK, as the UK diet changes, some of the common food allergies are changing. And so now we see patients that are allergic to things like dals and lentils and chickpeas and coconut. So if you think you might have an allergy, it's worth speaking to your doctor to get advice.
So if I go to my doctor, say my child, I'm worried, they've had dal, I think there's a reaction, what will they do to diagnose the allergy?
So diagnosing food allergies really relies on a good history. That's the information that you give your doctor about when the symptoms happen and to what foods or what other triggers. So if you've got notes, if you've got photos of what the reaction looks like, take that to your doctor. But additionally, allergy teams can also do special allergy blood tests or special allergy skin tests that detect something called IgE allergy antibodies. And that can help the doctor confirm whether you're allergic or not to the thing you're concerned about. But it's important to remember that sometimes those tests can be positive and you're not allergic, and sometimes they can be negative, but you are allergic. So it's really important that the person who's giving you advice is somebody who is trained in interpreting those tests.
I guess we should just say that in the context of asthma and the aero allergens, it's the similar type of testing, right?
Absolutely.
A doctor might request skin tests or blood tests to look if you've got an allergy to the fuels you're breathing in as well to help make the diagnosis.
Definitely.
Right. Okay, so how do we manage those immediate food allergies? Because I think they're the really worrying ones, right? Where you see your child having difficulty breathing and you're thinking, what can I do about this?
So if you've got an immediate allergy to food, then your doctor will advise you to completely and strictly avoid the food that you're allergic to. And they will give you training of how to safely avoid those foods. They will also give you training of how to manage an allergic reaction. If you were to accidentally have an allergic reaction, and they can also prescribe you emergency medication. So if you have that reaction, then there will be medications you can use to treat that reaction. And it's really important to train other people that might look after your child as well. So if you've got grandpas or school teachers or friends that are going to look after your child, they should know how to look after their allergies.
Yeah, very well.
So these emergency medicines, Sukeshi, you're here as our pharmacist and our expert in medicines. Tell us about these medicines that are taken for treating these quite worrying allergic reactions, or the range of medicines that are used to treat allergic reactions.
Sure. So there are two mainstays of treatment. The first is antihistamines. They come as either tablets or liquid, and usually they're taken when there is hives or lip swelling. But when it comes to coughing, wheezing, they look like anaphylaxis, then you use the pen. And actually, when you use the pen, there are three. When you use anything for an anaphylaxis, there are three main points to remember. Mm-hmm. The first is the position. So the position has to be with the leg out, and then the pen is used. So the first thing is the positioning. The second is the pen. And effectively, you take off the lid, put it halfway down the thigh, and press like so till you hear the click, and leave it in there for 3 to 5 seconds. So I'm just going to do that so you hear the click. There we go.
Okay.
Okay.
Fairly straightforward, isn't it?
Yes, and then the final thing is to call the ambulance, the paramedics. That's the third P.
Okay. And are there any other medicines that we might use if it's a really severe reaction?
Yes, then you would have to go on to steroids.
Okay. So that's a bit of a scary word for some people. Steroids, when we mention steroids, people get very worried. And of course, in the context of asthma, steroids are really important in terms of treating and managing asthma. So tell us about the role of steroids specifically in the context of asthma and why they're important.
So if we go back to when you did the introduction to asthma, we talked about inflammation. That's the most important thing. We need to treat the inflammation. Okay. And traditionally, we used to use a blue or blue and a brown inhaler, or a orange and a blue inhaler. And what we now know is that you've got to use the two together. It's the inflammation that we're treating. And so it's really important that this brown one is used regularly. But whenever there is a breathlessness happening, you use the two together. Never is the blue one to be used on its own now. So what's happened is there's been a change in the guidelines, a little bit like an update, like your iPhone would update or your Android would update. We've had update in the guidelines. And what they are now recommending is something called MART, so maintenance and reliever therapy. And what we're now using is combination inhalers, either in metered dose inhalers or as a turbohaler.
Okay, so that contains the blue and the brown in one.
That's correct. Both of these contain the blue and the brown in one.
And the brown has the steroid in it, which
That's
dampens
correct.
the inflammation. And the blue just provides temporary relief, right?
The blue helps to open it up, but the difference between the blue in there and the blue in these ones is that that is a very short-acting one. And sometimes you can get a lot of different types of side effects. So it's no longer recommended on its own. Whereas what is contained in these ones is the fast-acting, long-acting ones that are shown not to give these changes.
Okay. So it opens up the muscles that we were saying that contract.
That's correct.
But it opens them up immediately and has a long-acting
Long action.
And has the anti-inflammatory in there. So it's like everything 2-in-1, buy one, get one free type.
Absolutely.
So you're just using one inhaler.
Just one inhaler.
Do not worry about anything.
You don't have to worry about anything.
Okay. So there's just one thing I need to ask you, because often patients come to me and families come to me and they know they've been prescribed things, but they have no idea how to take it, right? There's lots of different inhalers. You can choose one. They're all taken differently. Tell us about the most common types that are used in children and how they should be used.
Sure. So I'm just going to go through two different types of inhalers. So I'm going to use a dummy. So these ones are called metered dose inhalers. And the way they always, don't look at the films or anything, they have to be used with a spacer. So either this one for babies and this one's for slightly older children, but only up to the age of 3 or 4.
Okay.
That's when you use what is known as the mask spacer.
Okay.
And then as soon as they're ready, they go on to the mouthpiece one. And most people can do it by the age of 3 or 4.
Okay.
And usually what we do is with the metered dose inhalers, you've got to shake them because there's a gas in the liquid and the powder drug is within.
Mm-hmm.
It then goes into the spacer like so. So you shake, like so. And then the breathing is quite important. It's slow and steady. So
You have to press it?
yes. Good test. So you press that and then slow.
So that's why I want to ask you, because why do you need a spacer? Why can't we just go?
Because what happens is that when the gas and the liquid is released, if you look, it comes out very quickly.
Yeah.
So when it comes out, it goes to the back of the throat and can just go into the tummy.
It
So
doesn't
we
actually go into the lungs.
No. So we want to slow it down so it gets right into the lungs. But not only does it get into the lungs, it goes into lower, smaller airways. That's right, yes. So yes, so that's the metered dose inhaler. And now traditionally, we're using the dry powder inhaler. And
Does that need a spacer?
this does not need a spacer.
Okay.
A dry powder inhaler is used on its own. And it is a common mistake, you're spot on,
Yeah.
because people think that this can go in there, but it doesn't.
Yeah, so that's the thing. People get confused, right? So it's really important to be taught how to do it.
Absolutely. And
Would the community pharmacist teach parents and children how to do it? Is that what?
community pharmacists can definitely teach,
Okay.
and there are a lot of schemes in community pharmacy now
Mhm.
that sort of have a lot of training, and your community pharmacist can teach
Show how to do
and
it.
show, and there's a lot of incentives for community pharmacists to do it now as well.
Okay, great.
And with the dry powder inhaler, the most important thing is you go one way, you click. But the most important thing is the quick and deep breath.
Mhm.
So I'm just going to use a whistle because this is what we use to see if a child can actually use it. So I'm going to show you the whistle. It's going to make a noise. It goes that way, and then horizontal, chin up.
If the child makes the noise, it's a good enough breath to use that.
Yeah, but remember, this is a whistle. This is a demonstration
It
device.
won't be on the real inhaler.
And it's not on the real inhaler, and it's only used by people like us to make sure that a child can use it. But if you were just to use that, it's the same. You just go that way and then back. It's vertical, then horizontal. Breath out, chin up.
Right. And I can see there in front of you, you've got some plans.
That's
asthma
correct.
plans and allergy plans. Just tell us briefly about them.
Yes, so this is an allergy plan, and it goes through, there are two different ones. There's one for an EpiPen, one for a Jex pen, and it just goes through how to use it, what to do. It gives you emergency details, and that's the most important thing. And these plans should be in schools, it should be in grandma places, carers, anyone that has them. And it's the same with the asthma plan. So now we have the Asthma and Lung UK plans. This is an asthma action plan of using the brown and the blue inhalers. And then this is the maintenance and reliever, the MARC plan.
Great. And we're going to give some resources at the end to everybody, so you can look up how to get these plans and get some resources from the website.
That's right, yes.
Excellent. So we're kind of coming to the end of our kind of introduction to asthma and allergies. Just before we give you some 3 key messages, there's just one group of children that I wanted to provide a little bit of clarity about because it can cause confusion. We focused today on allergic asthma in children, and that usually applies to school-age children from about the age of 6 and above, who are old enough to do tests, who often have allergies and should be treated with the steroid inhalers. But the under 5s often wheeze, especially with colds. They can have difficulty in breathing, they can have wheezing. The majority of those children often do not have allergies and so should not be treated with steroid inhalers. The reason they don't have allergies is because their narrowing of their breathing tubes is caused by mucus. I don't know if you can see this horrible green stuff in this airway. That's mucus. So when a young child under 5 gets a cold, they get a runny nose, and the same phlegm that's causing that runny nose goes down into the lungs and causes the airways to become narrow and makes the child wheezy. Now, because that's not caused by inflammation, the steroid inhalers often don't work, and the treatment for those children are inhalers to just open up the airway, like the blue one, allow the child to cough and clear their secretions, and then they improve. So I just wanted to clarify that the under 5s can be a challenge. They can be a challenge to treat, but they're not always treated with steroid inhalers because they don't always have allergies. Okay, so before we go on to our questions, we're going to give you 3 main take-home messages from each of us. Nandinee, what's your main take-home message?
So my main message is, if you're worried about allergies, don't start avoiding foods, don't treat yourself, don't test yourself. Go and speak to your doctor to get advice and possibly be referred on for testing if appropriate.
Don't guess. Great.
Absolutely.
Okay. Sukeshi, what's your message about treatments for asthma and allergy?
3.
Okay.
The first is take your medicine as prescribed, because if you don't take your medicine, it's not going to work. The second one is that make sure that the child can use whatever they've got, whether it's a pen or an inhaler of any kind, that they can and that they will use it. And then the third thing is that everyone around them, carers, parents, school teachers, everyone should know what to do in an emergency, know what the plan is, know how to use an EpiPen, and know how to use inhalers. And that's quite important.
That's great. That's really helpful. And I guess from the point of view of asthma in children, I guess I want to emphasize that it's a common condition, but it can be a serious condition in children. However, if it's diagnosed and treated properly, we've got really effective treatments, and children with asthma can lead completely normal lives. And I think that's the kind of main message we should be giving to everybody. Okay, so I'm hoping there are some questions in the chat. Before we go to those, we're just going to do some really quick fire myth busting to try and really reinforce to everyone not to be scared of asthma and allergies. So I think Nandinee's going to come to me.
Absolutely. So first statement, there is a cure for asthma?
Unfortunately not. That's what I spend my life doing, trying to find a cure for asthma. We don't have a cure for asthma yet, but we've got really good effective treatments. So if children take their treatments and take them properly, they'll be absolutely fine.
Great. And then this one we hear quite commonly, you can grow out of your asthma, is that true?
So some children do stop having asthma symptoms, especially boys, and especially around puberty, actually. There's something about the hormones that changes and they can get better. And the under 5s that I was talking about, who don't always have the allergic type of asthma, can often grow out of their asthma as well. So it is possible, yeah. Okay, Sukeshi, inhalers are addictive.
Nope. If they're taken as prescribed, they're not addictive.
Okay, so does where you live matter?
Yes, it can matter. So pollution, molds, house dust mite, like you said. But if you take your medicines correctly, then it's lesser of an effect.
Okay. So Nandinee, I've got asthma and I've got cats and they don't affect me. What's the problem?
Okay, so you might actually be allergic to the cats that you're living with, but you don't notice it because you've been living with them for a very long time. So if your asthma is not well controlled, it's still important to get tested to see if you've got an allergy to cats, because if you were to have an asthma flare, the cats that you're living with might be provoking you to have a more serious asthma flare.
Okay, Sukeshi, I know smoking's bad for asthma, and I tell all my patients they mustn't be around people who smoke, but vaping's fine, isn't it?
No. The thing with vaping is that they contain chemicals that we know nothing about, absolutely nothing. And we don't know the long-term effects of vaping. So no, I wouldn't say it's safe.
So Sejal Ben, I've heard a lot of families say that you only need to use your preventer when you're unwell. Is that true?
Absolutely not. The one time you must use your preventer is always to keep the inflammation dampened and keep your airways looking healthy.
Okay. And another one, if I don't wheeze, then I don't have asthma.
No, not true. And that's why I've talked a lot about breathing difficulty and the shoulders and the ribs, because often the wheeze is only heard by the doctor with a stethoscope. You might not hear it loud, but it could still be there.
Okay. And then asthma attacks come out of nowhere.
No, I don't believe that actually. Usually what happens is that symptoms build up gradually. There are triggers for asthma attacks, like the common cold or being exposed to something that you're allergic to. And symptoms will build up slowly into an asthma attack. So you can preempt it and do something about it.
Okay.
Okay. Do you want to ask me about nurseries?
Yeah, I can do. In terms of sending your child to nursery, is that going to cause asthma?
No. There is a concern that if you expose young children to lots of colds and they get wheezing, then you might make them get asthma, but absolutely not. Going to nursery does not cause asthma.
Okay. And what about the fact that all asthma is caused by allergies? Is that true?
So in children, the majority of asthma is caused by allergies. There's no doubt about it. 85 to 90% of children have allergic asthma, but not all asthma, especially the under fives, and some older children may not have allergies. Keshi, I've got the $1 million question for you. People with asthma should not exercise. Absolutely
not true. Kapil Dev, the Indian cricketer, he has asthma and he runs a lot.
Okay, so we should all be leading a normal life.
Absolutely. Exercise is good for you.
Excellent. Okay. So we're now going to move on to some questions that we've got from the audience. Thanks very much, everybody. Please do keep posting your questions in. So I've got a question, and Nandinee, this is for you. Why do children have so many allergies these days? Why is there an allergy epidemic?
Okay, so it's right what people observe, that there has been an increase in the number of people that have food allergies and allergies in the UK, but that level and that speed of increase has started to settle down in recent years. So actually, if we think about food allergies, probably approximately one child in every classroom will have a food allergy. But another thing to say is I know people think about wonder where food allergies come from. So there is a genetic component. There is a tendency within families where there are allergies to have a higher likelihood of developing allergies. But there are a lot of environmental factors as well that contribute to this.
I guess it's a combination of factors, right?
Yeah.
It's not that allergies are necessarily going up, perhaps also we're more aware of them and perhaps recognizing them more.
Yeah, there's increased diagnosis, but there has been an increase and that has started to plateau off.
Okay, so that's reassuring. So the next question, I think I'll answer because it says, what are the long-term side effects of steroid inhalers? Well, to be completely frank, if steroid inhalers are taken properly, and in the majority of children, we need to use very low doses, there are no long-term side effects. There are far greater side effects of not taking steroid inhalers for children with asthma, i.e. they have difficulty in breathing, they don't grow properly, their lungs become damaged long-term into adulthood. Far more side effects of not taking steroid inhalers than taking steroid inhalers. And the thing to remember is the steroid dose in inhalers is tiny compared to the dose that you would have if your child has an asthma attack and needs oral steroids. Those doses are huge and they result in side effects. There are no long-term side effects of steroid inhalers taken for asthma if taken properly and regularly. And I feel fairly confident in saying that. Would you agree?
Yeah, absolutely.
Okay. So, Nandinee, another one from you. If my child has a food allergy, can it go away in the future?
Yeah, so absolutely. So there are some food allergies that are quite commonly outgrown. So things like milk allergy, for example, or wheat allergy sometimes. And then there are other food allergies like peanut allergy or sesame allergy that are more persistent on into adulthood. But even in those cases, occasionally you can outgrow those allergies. So if you think that your child might be outgrowing their allergy, it's worth getting re-referred to get reassessed.
Okay, great. So, Sukeshi, I've got one for you here. How important is it to have an annual asthma review?
Oh, very important.
Why?
Because in an annual assessment, what happens is that someone will step by step go through your inhaler technique, they'll go through your medicines, they'll go through your plan, or they might change your medication. They might do tests just to see where you are and how you're getting on. So it's really important to go for those annual checks just to see how you're going. Sometimes they might need stepping up of doses of inhalers, but sometimes you might even step down on inhalers. And that technique check is so important.
Just a reminder.
Yeah.
And I guess the other thing is, as you said, there's been an update recently, right? If you don't go for your annual review, you're not going to know about the update, and there's not going to be that kind of change in your treatment plan.
And you won't get an updated medication, an updated plan. So things are moving quite a lot in asthma. So it's really, and allergy. So it's really important that annual assessments for both happen.
And one thing to add into that is, actually, when you go for those appointments, don't just sit and answer the questions you're asked. Ask your own questions as well. So if you've seen a different child using a different inhaler, if you've noticed certain patterns with your child, ask about those when you go for your checkup, because what you're wanting to do is really optimize your child's asthma control in those appointments.
So I guess leading on from that and what Sukeshi mentioned about updates in the context of allergy, should women avoid eating foods like peanuts during pregnancy?
So that was a really old recommendation and things have changed. So we no longer advise any avoidance to particular foods if there's concern about allergies. What that means is when you're pregnant, you can eat foods as normal, your peanuts, your nuts, your sesame, etc., as you would in your normal diet. Okay. You shouldn't avoid things. No.
And then what can people do? We're being asked, can I do anything to prevent my children from getting a food allergy?
Yeah. So there's no one specific thing that people can do to prevent food allergies, but some common things in infancy that you can do. So one is that if your infant or toddler has eczema, what we see is it's really beneficial to be proactive about treating that eczema and not delaying treating that eczema. And then secondly, having a good varied diet for your infant. When we're talking specifically about introducing foods to babies, there's been a lot of research in this area. And so a couple of things that have come through in global guidance. One, firstly, is allergenic foods like peanuts. Introduce those to your baby when you're weaning. So the right time to wean is when the baby is ready to wean, when they're showing signs that they've developmentally progressed and are able to start having solid foods. And that's normally around 4 to 6 months of age. But when that happens, you can introduce those kinds of food like peanut and sesame. When you introduce them, you should introduce them consistently. So don't start them and then avoid them for a few weeks or months and then introduce them again. Keep them consistently in the diet once you've introduced them. And then third, final thing to say here is if your child has eczema or already has a food allergy, delaying introduction of other foods can increase the risk. So don't delay introduction of other foods. Common foods that you eat in your home environment, start including them in your child's diet. But an important thing to say is don't apply creams that contain foods on your child's skin, especially if you haven't introduced those foods into your child's diet, because that can cause antibodies to develop.
I guess the message is we should be feeding our children what we're eating. And
Absolutely.
It's absolutely safe to do that. There's no need for our children to have a specific child-friendly diet. And I guess perhaps leading with, connected with that is if we're breastfeeding, should we be avoiding or doing anything specific?
No, so there's no recommendations saying that you should be avoiding routinely any foods when you're breastfeeding. Eat what you normally eat. Eat what you were eating before you were pregnant. Introduce those foods and feel comfortable breastfeeding.
So the more your child's exposed to a varied diet, the better. Right?
We are seeing evidence that variety in diet is really helpful, and it really helps the gut to develop well. So don't restrict them to boring items. Keep that menu open.
I think that's really important, and that's kind of, it's a change in our own mindset, even amongst healthcare professionals, isn't it, over the last few years? So I think that's really important. Okay, can food additives cause allergies?
So there's a lot of theories about what things can cause an increased risk of allergies, and there's some different hypotheses. Some include kind of being in environments that are too clean. Now, we do see evidence that if you're living in rural areas, that you are less prone to get allergies than if you're in a more urbanized area. We also see things like ultra-processed foods or detergents, things that we're exposed to in the environment may have some association with increasing the risk of developing allergies, but there isn't definitive data about that. So it's hard to say yes or no, but all of these things are in balance.
Yeah. I guess it's the reaction and getting tested. So I've got one here that maybe I'll take. It says, are there any preventive measures? Or maybe actually I'll give this to you, Sukeshi. Are there preventive measures we can take if, for example, we're on a flight and have no inhalers handy? I'm not happy with that, but go for it.
That should never happen.
Exactly.
In the very first place, you go anywhere. Yeah. The most important thing is to take those medicines with you. And the thing is that people are worried about trying to get it through customs or whatever because of the volumes that this is considered as. But if you have a prescription to say this is what you're on and it's labeled, or even without it labeled, you have proof that you're on these medication, then
nobody will stop.
There is no excuse not to have that. Yeah. But, you know, should you not have that, I'm sure there are emergency treatments around on the plane, but I don't know.
No, we shouldn't leave it to that.
Absolutely not.
No risk taking, and inhalers and an EpiPen, if necessary, must be with you at all times.
All medicines should be in hand luggage.
Great. Okay.
There's one for you, I think. Can stress aggravate asthma?
I'm feeling stressed. Yeah, so there's absolutely evidence that your emotions and the way you're feeling mentally can aggravate asthma. There's no doubt about it. So physical things that we've talked about, like the things you breathe in and colds and that kind of thing, can aggravate your asthma. But similarly, yes, stress and emotion. So when it comes to exam times, often children's asthma will get worse. And exams are in the spring and summer when their hay fever is worse. So as Nandinee was saying, often it completely compounds each other. Your hay fever is worse, you're stressed, your asthma's worse, and everything can go around in a circle. So really important to just take the treatments regularly as you've been told to stay under control. And then emotions shouldn't affect your asthma.
Yeah.
Okay. So then we've got one that says, Nandinee, what is eczema and is it related to gut health?
Okay, so eczema is a itchy skin condition that is mostly genetically driven. So it's a condition where your skin can dry out more and it can become itchy, but it can also lose a lot of moisture. So the main kind of treatments in this area are skin treatments, creams, but gut health, in terms of the importance there is some relation with eczema and allergies, but not directly related to gut health on its own. Allergies more generally are related to gut health, but eczema the focus here, and some of the triggers are very similar. So common triggers for eczema flaring up include stress, infections, and sometimes things in the environment. So sometimes grass pollens and tree pollens or house dust mite can flare up your eczema. More rarely, it's triggered by food allergens.
I think there's a really important here. It says, if my son has an allergy, I assume it means a food allergy, can I give him a very small amount of the food so he gets used to it?
Yeah, okay. So the standard international guidance is still very much, if you've got an immediate food allergy, that's the kind of food allergy where you might experience anaphylaxis, you might be at risk, you might be prescribed an adrenaline pen. The advice there is complete, strict avoidance of that food that you're allergic to.
At home, right?
No.
It's dangerous.
There are very specific scenarios where some newer treatments are available, but those should only be undertaken under specialist allergy advice and guidance. So standard advice, avoid.
So there is a question about whether women more commonly get asthma. And I think I kind of alluded to that earlier. It's interesting. So in childhood, boys tend to have asthma more. It's probably about a 60-40 split, maybe 70-30. But something does switch around adolescence and puberty. And at that time, then girls tend to become more affected and ultimately women. So in adults, women are more affected than men. And in childhood, boys are more affected than girls. But we don't know why. We think it's something to do with hormonal changes. Okay.
There's one here for you, Sejal. So it says, why is the flu vaccine important for children with asthma?
Okay, so that's really important. So really important message. All children with asthma must get the flu vaccine. And the reason is the most common trigger for asthma attacks or asthma symptoms getting worse are any viral infection. So anything that gives you a cold or a runny nose is likely to make your asthma worse. And the thing is, in children, we know that viruses affect children with asthma more, can give them more severe disease, and it takes them longer to get over the infection. So it's really important to give any vaccines that are available for viruses to children with asthma. And the one that is available is the flu vaccine. Yeah. So that means that the child will have a less severe infection and will cope with the flu much better if they do get it.
Yeah, yeah.
Okay.
In fact, they're done in schools now, aren't they? The flu
Yeah,
vaccines,
exactly.
and just in the nose.
Offered in schools, and there's no reason that a child with asthma shouldn't be able to have it. There's only, I guess, some of the vaccines can contain allergens, and if you're worried about that, then go to your GP and get their advice about which vaccine to have.
Sejal, there's another one here, which I know we've covered, but I think it's really important because we know lots of families worry about this. So I'm really worried about the side effects of steroids. Are they really needed for asthma?
Yeah, there's a single word answer, yes. And the thing to really say again is the dose of steroids in the inhalers that we use for asthma are really small. They're 1/100th or 1,000th of the dose that are used when a child has an asthma attack and they need oral steroids. And the other advantage of the inhaled steroids is they go directly where they're needed, right? They go into the lungs. They don't go into the rest of the body, which is where all the side effects come from. They don't go to your bones. Yeah. They don't go into your bloodstream. They don't go onto the skin. All the places that cause the side effects, those come from steroids that you take by mouth. The inhaled steroids are low dose, go directly to the lungs where they're needed. So they're really safe, and yes, they're needed.
And another thing to probably say there is that actually there are lots of other negative consequences of undertreated asthma.
Absolutely.
And so balancing taking some inhaled steroids and keeping really good, healthy lungs for the whole of your life versus having undertreated asthma and having inflamed lungs that sit with you and affect what your lungs look like when you're 60 or 70 years old. That's a responsibility we're taking on with
and
treating.
We know that badly controlled asthma in childhood results in premature adult death. So there are consequences in adulthood. You can't not take it seriously.
And think about it. You think about steroids. Yes, and like you say, we say it's in micrograms when it goes into the lungs, very targeted, directly there, nowhere else, and milligrams when you're old. But think about this from like a parent or a carer point of view. Their quality of life is affected if you don't give them those medicines. And actually, you're not then allowing them to exercise, to run around, to play football, to do things that they can do.
Yeah.
And really, is that what you want to take on versus, something, side effects that could be quite minor?
They're non-existent, really, I think, if they're taken properly. Children with asthma should be able to lead a normal lifestyle, like I said. We have one final question, Nandinee, which is, if asthma seems to be triggered by milk or milk products causing wheezing and shortness of breath, is that asthma or allergies?
Okay, so it's really important that you get help differentiating what's going on in this kind of situation. And that's where you want your expert doctor, allergist, respiratory doctor helping you make the diagnosis. Because if you have got a milk allergy and you accidentally consume some milk and then you become wheezy, that is anaphylaxis, and you should be treating that with your EpiPen. And so it's really important to be really clear about whether you have a milk allergy or not. And if you're uncertain, go and seek advice. Now, we might think, oh, peanut allergy is more severe or tree nut allergy is more severe. Actually, milk allergy is one of the most severe allergies that we have, especially if it persists into older childhood or adulthood. And it can cause really severe reactions and can cause life-threatening reactions or fatality. So really make sure you get the diagnosis right for your child.
Okay, so we're coming to the end. Thanks both very much for joining us. Really grateful, Sukeshi, to you for coming in and being our kind of expert guest. Really grateful. Thanks, Nandinee, for all your help. And just to let you know, we will put some resources in the chat to help you find some guidance about asthma and allergies in children and some of the things that we've discussed today, which hopefully you'll find helpful. If you found our first live conversation interesting and exciting and helpful, then please do fill in the feedback form. That will be in the chat as well. Be very grateful. Actually, what we would really like is your feedback on whether this is helpful and the types of topics that you would like us to cover in these sessions. So that for us is extremely helpful. Thanks very much for joining us today. Thanks again to my great guests and Jeshwam.
Yes,